Good afternoon, everyone. Thank you all for joining us today. We're going to go ahead and get started. We're a little bit behind, just a couple of minutes, but I want to thank you all for joining us today. I believe this is our third installment in our Friday lunchtime Q&A. I might be just a little bit wrong, but it's either a third or fourth. And today our topic is Ask a Small Ruminant Veterinarian. So it's a live Q&A. At registration, you would have had the option to submit questions. We did get a whole lot of questions submitted, a number of them. However, there were some clear themes that you could see. For instance, we had a lot of parasites, a lot of questions on how to control internal parasites in sheep and goats. These Q&As are a collaboration between myself at Virginia Cooperative Extension, my colleague Susan Shanian at the University of Maryland Extension, Nikki Whitley at Fort Valley State University, and Kwame Matthews at Delaware State University. Or speakers today, or veterinarians today, are Dr. Ann Zajac, Dr. Kevin Pelser, and Dr. Jamie Stewart, all from Virginia Tech. Because we had a whole number of questions, I'm just going to go ahead and just delve right into those. We are going to try to get through all the submitted questions. In today's presentation, we'll do our best. So I do apologize if we're not able to get to your questions, because there were a lot that did come through. So I believe I'm going to start with Dr. Pelser. And the first question I'm going to direct at Dr. Pelser is, how do I keep my sheep and goats healthy, and how can I identify an animal that is unhealthy?
Well, the best method to keep your sheep and goat healthy are to come up with a preventative health program, and that should center around vaccination. And there were several questions about what vaccines are needed, and we'll touch just briefly on that. And then also a good preventative parasite program utilizing the FOMACHIS score system, and I'm sure Dr. Sajak will have some words of advice on that. And then a good feeding program. And for the most part, feeding programs are pretty simple for sheep and goats. The major issue that I find in the realm of nutrition is that during the winter months, when we're feeding stored feed, people really don't have a good handle on the nutritional quality of their hay. And so if there's anything, I would recommend producers to work with their extension agent and collect a forage sample and have that analyzed at a lab so that they can identify deficiencies in their forages early, so that they can either come up with new forages or adequately address those deficiencies with the supplementation of grains. In regards to vaccines, the vaccination program can be very simple in that Clostridium perfringens C and D and tetanus, often referred to as C, D, and T vaccine, is the core vaccine for sheep and goats. Animals should be vaccinated at a minimum of once a year. In the case of the pregnant female, we generally recommend that this vaccine be given 3 to 4 weeks prior to lambing or kidding. That way, antibodies are produced for or by the dam and provided to the lamb or the kid, providing them protection for those diseases during the first month to 6 weeks of life. Bucks and rams should be vaccinated. Generally, a good time to do this is at the time that they're prior to being placed into the breeding female groups. It's when they're going to have most likely opportunities to develop wounds that could result in tetanus. And also they may be supplemented with grain, which would constitute a change in diet, which is important to think about in regards to Clostridium perfringens and perfringen C and D. Also, there's a question about, well, let me go back for just a second in regards to the CD and T vaccine. It appears that goats either don't mount a high response to the vaccine, or that response is not as long-lived as it is in sheep. Some farms may need to booster or vaccinate twice a year with the CD and T because many goats only develop immunity for about 6 months compared to the sheep that generally develops a good immunity for a year. So that's something to consider in your program, especially if you're feeding a lot of concentrates or grains to your goats, or if there are opportunities for digestive upsets throughout the year due to differences in grazing different areas or feedstuffs. There was a question about giving CD and T antitoxin and if you still need to vaccinate for CD and T, and the answer is yes. CD and T antitoxin will only provide protection for about a week. And so those animals that might receive that do need to be given a CD and T injection. Generally, I'm sorry?
No, go ahead.
Let's see. So other vaccines that may be given with some regularity are the vaccines to prevent against abortion. Those vaccines are chlamydia and Vibrio, or now known as Campylobacter. Those vaccines would be given a month prior to the breeding season. And then you need to read the vaccine label, because some of those suggest that a vaccine be given 6 weeks after that, or maybe even mid gestation. So it's important to look at those recommendations on the vaccine label. That's pretty much all of the vaccines that we give on a routine basis for sheep and goats.
Okay. Then, so one of the producers asked if you don't mind turning your camera on. They wouldn't mind seeing your face while you're talking, if you don't mind.
Well, I can try that. The other day, my wife was on a Zoom meeting and I was, and we crashed our broadband Zoom. And so we had to like start all over. So I've been tending not to show my face in these different Zoom sessions. In regards to the grooves around the horn in goats.
Dr. Pelser.
Yes.
If you don't mind, we're gonna sort of rotate the questions.
Okay, great.
And so so we'll get to cover, just about
no
a little
problem.
bit of every topic. So sorry about that.
No problem.
But we'll come back to that groove question. The the next question is for Dr. Zajac, and that question is, what is the current recommendation for monitoring and treating sheep and goats for parasites to reduce the incidence of drug resistance on farms?
Hello, everybody out there. Thanks for inviting me to participate today. Unfortunately, there's not a current recommendation. And the big problem with parasite control is that it has become such a difficult topic for people because we're faced with drugs that don't work particularly well. It's difficult to make one recommendation that fits every circumstance. I think, as Dr. Pelzer mentioned, I think there's no question but that it's really, really valuable for producers to be using pharmacocards to monitor the health of their animals. I can't emphasize that enough. In virtually every part of the US, Haemonchus, barber pole worm, is the principal parasite problem. It is a miracle that we actually have a way for you to monitor the damage being done by that worm. It's unique amongst pathogens, really, that you can go in and look directly at the disease that's being caused by that parasite. It's such a valuable tool for producers that really is the best way to keep an eye on worms as a parasite problem. You want to get the card. In the peak of the transmission season, you need to be looking at animals every couple of weeks. Don't stretch it out. The big advantage to the Pharmacia system is that, in my mind, is that it allows you to see the problem developing before it reaches a point where you're going to lose any animals.
Mm-hmm.
Before Pharmacia, you'd go out one day, everybody would look great. You'd go out the next day and someone would be dead. And that's because it was so difficult to see the development of this serious anemia problem. With a Pharmacia card, you see it coming, you have a chance to intervene before anybody reaches a point where they either die or get so anemic that you can't easily bring them back. So I'm the biggest cheerleader out there for that card, and I really think every single sheep and goat producer needs to have one. So that really is a recommendation that I think can be made for everybody. I think the second part of that question was about treating. Treating becomes something completely different again, and there we don't have a consistent recommendation for everybody. We want you to use targeted selective treatment, and that's what the Pharmacia card helps you do. It helps you decide who needs to be treated so you're not wasting treatments. So that's your basic program, is to use that system to identify those animals that need treatment. It's not a case anymore of saying, go out and treat everybody every month. That's old-fashioned thinking that won't stop you from having problems, and it just contributes even more to the development of drug resistance. So I'll stop there, and then if we want to pick up a related question or go on to asking Jamie a question, whatever you want to do.
Thank you, Dr. Zajac. Dr. Stewart, your turn. The first question we have for you is, what is the best out-of-season synchronization protocol for sheep?
Okay, and I'm going to actually address this for both sheep and goats, since I know we have both people here. And so some of this is going to ultimately depend on your individual herd or flock, and the reason for that is because some of the things that you might need to do are going to depend on your breed. So the top thing you can do if you want to do out of season breeding, and it's going to depend on what purpose. So if you're doing it for meat, milk production, you can do, and you have a certain breed, there's a whole list of them that don't tend to cycle out of season is you can do some crossbreeding. Now, some people like to stick with purebreds, and when you do that, you run the risk that they're not going to respond as well to some of your manipulations. So some of the things that you can do, probably the most common things are going to be using CEDARs. And so this falls under the category of hormone manipulation. And so, you know, just like during the season when we synchronize, we can synchronize out of season to try to convince them to come into season. For the breeds that will respond well, things like your Dorsets, your Polypays, Rambouillets, most of your haired sheeps, Boer goats, on and on, a lot of those will respond pretty well to doing hormone therapy. And so the most important thing I have to say about hormone therapy is you have to use a progestin source. And so that would be your CEDAR. And so a lot of people will try to give just the prostaglandin because we know that when they're in season, you go out and give a dose of prostaglandin and most of them will come into heat. And that's not going to work out of season. They have to have that prostaglandin source with the removal of it for them to come into heat. And then usually what we do is we usually do a week to 2 weeks with the CEDAR in, and you pull that, and a lot of people will want to give something like a PG 600 or a PMSG, something like that. And a lot of this stuff needs to be, and I know at one of the other seminars, this was already mentioned, is that this needs to be prescribed by a vet if a lot of these are being used extra labels. So the CEDAR is labeled for sheep, so you can use that without necessarily getting veterinary permission. But if you're going to use some kind of ovulation stimulation, you need to really work with your veterinarian to make sure you're using everything appropriately. Some of the other things that you can do if you don't want to go for the hormone is, and again, this is going to be much more effective in some of your breeds that are a little bit less seasonal, is you can do different lighting regimens. This, it's very high intense management. So remember that our sheep are short day breeders. So when we have longer night times, so that increases the melatonin production, they're going to be more likely to cycle. So these animals, you're going to have access to indoor facilities, and you have to plan it well in advance because you have to do several weeks of long days and then followed by several weeks of short days. So you have to plan this months in advance if you want to do that and have the facilities. So unfortunately, it tends to not work very well. And I know you'll see a lot if you Google ways to do this, a lot of people talk about melatonin and giving that as either an implant or feeding it. It's not commercially available in the United States, so unfortunately your options here are going to be limited, and you'll be hard to find somebody who can actually get it for you and willing to do it, just because, again, it's something that's not labeled in the United States. So other things would be using what we call the RAM effect. So and again, like I said, it's going to work better in some of those breeds that work out of season, where you basically have to keep the ram away from the does for anywhere between a month and 2 months. It works better the longer you can keep them away. And then you suddenly introduce them. They all have what we call a silent heat, or it's going to be a non-fertile heat. And then usually in about 18 to 24 days, they'll have another heat that he can actually breed them on. And then the last thing that you could do, one of the things, and if we get to some of the other questions I have, is and Dr. Pelzer already alluded to this, is nutrition is key. So things like you can do what we call flushing the does, where about 2 weeks before breeding, you're going to start giving extra high energy and protein in the diet. And again, I would work with your veterinarian to come up with specific recommendations for your herd as far as what exactly to feed. But you want to do this a couple weeks before breeding. And what that does is it's going to help them to promote ovulation and help them to ovulate more than one follicle, because usually, you know, we like to have twins in these creatures instead of a single. So it's going to help them to do that. So that's just one of the other things you can do. So I think I have my little list there to make sure I didn't forget anything. So I think I got most of it there. So
thank you, Dr. Stewart. For moving back to Dr. Pelzer, that question about the calcium deficiency, do grooves around the horn indicate a calcium deficiency? So could you talk some more about calcium deficiency in small ruminants, including camelids, and indicate to us what some of the symptoms are, the treatment, and if those groups around the horn would indicate a calcium deficiency?
To answer the question in regards to the rings around the horns, generally that's an indication where there was some kind of nutritional stress. That nutritional stress could be a change in grass, change of lack of nutrients, mainly protein and energy within the diet, or lactation or parturition. So the rings really don't indicate a deficiency as such. They just indicate some sort of change in that animal's nutritional makeup. In regards to calcium deficiency, we're fortunate in sheep and goats compared to cattle that we don't see the typical milk fever and things like that unless you're dealing with dairy breeds. The time that we do notice calcium deficiency in small ruminants generally tends to be during the last part of gestation, which is also the time when we see pregnancy toxemia. And oftentimes pregnancy toxemia and calcium deficiency go hand in hand, mainly because there's a lack of intake of nutrition in general at that time for a variety of reasons. The best way to manage both the selenium issue as well as calcium is to provide a mineral salt rather than just a trace mineral salt to these animals during their pregnancy.
Okay, thank you, Dr. Pelser. Rotating back to Dr. Zajac, when you discussed your recommendations for monitoring treatment, you did address monitoring adults versus young flocks, that all would be monitored with the FAMACHA and just deworm based on need. Could you address for us dewormer rotations? Is it advisable for us to rotate dewormers between treatments or not?
Well, we used to always talk about rotating dewormers as a strategy to slow down the development of resistance, and often would talk about rotating among the drug groups annually. But what has happened over the last 20 years or so is that the amount of resistance to dewormers has become so huge. It's such an overwhelming problem with all the drug groups that we have, that rotating in the way that we used to do is really not giving you much benefit anymore. I feel certain that I can go to the farm of anybody who's participating today and test your animals and find that there's barber pole worm there that's resistant, at least partially resistant.
Why don't I have a camera?
To one or more drug groups. There's just so much resistance. So what we're recommending now is, instead of using that strategy of rotating among the dewormers, it's much better, in fact, to use a combination treatment where you're giving, when you do a routine treatment, you're treating with at least 2 drugs from different drug groups, so that if you have resistance to one or even both of the drugs you're using, you'll still probably get some additive effect, and you'll have a much greater benefit than trying to sort out which single drug might still have efficacy in your flock. There is just so much resistance out there that the recommendation has really become deworm with a combination treatment. So you're not mixing drugs together in a syringe or in any kind of container. You are giving one drug, say ivermectin, and then immediately at the full dose that you're meant to be given, and then immediately after that, follow with a treatment with levamisole or one of the white drenches, albendazole or fenbendazole. So you're giving 2 drugs at the same time orally, and you have to follow the withdrawal time, the longest withdrawal time. So if one has a withdrawal time of a week, one has a withdrawal time of 2 weeks, you have to follow that 2-week withdrawal time.
Okay, thank you, Dr. Zajac. Jamie, the next question I'm going to throw at you is, one producer asks, every breeding cycle we have dealt with a high number of lambs getting polio. Is there anything we can do to prevent this from happening?
Yeah, and I might actually kind of, because the next question you have on my list also talks about polio with a couple other diseases.
Mm-hmm.
And a lot of these diseases fall back on management. So remembering that things like polio, most of these polio and white muscle disease are both nutritional related. And Dr. Pelzer just kind of made a note in here about supplementation of selenium. So, and I know you guys are all from different areas, so whether or not your area is deficient, again, this is something you should work with your specific veterinarian to kind of develop these protocols. But polio specifically is what we call a thiamine deficiency. And so this one, some of the things that you can do to prevent, one of the things is making sure that everybody has good quality roughage. And if you can't get the good quality roughage, so again, Dr. Pelzer was talking about the nutrition, is making sure that you're doing supplementation. Doing supplementation in the feed could be really necessary. Some of the other problems that we see, especially with lambs or kids, is that when you're starting to change their diet, sometimes you change it too fast and you cause what we see as a mild ruminal acidosis, or subclinical. So you're not actually seeing any other problems with it, but because they're starting to change those rumen microbes because you're transitioning them to a forage and grain diet, they're going to decrease the bacteria in their rumen that are going to be producing this thiamine that they need. And so the slower that you can change their diet, the better off you are. And if you can't do that, then making sure that you're supplementing enough thiamine to ensure that that they're getting enough. Other thing is there's certain plants that will have what we call phytothiaminases. So, and these are things that, so thiaminases are something that will break down the thiamine that they need. So things like bracken fern, horsetail, pigweed, those are all things that might have an effect. So if you can avoid feeding some of those, especially in your young animals, your lambs and your kids, then you'll see a little bit lessening of that effect. The other thing is if you're using milk replacers, there are some low quality milk replacers out there that won't have the amount of thiamine needed as required. So you want to make sure that you're getting some high quality milk replacer that's going to have that thiamine content. And then just since I'm just kind of along the same lines of nutrition, again, I already said Dr. Pelzer talked about selenium, but white muscle disease, that's what we consider the vitamin E and selenium deficiency. So and a lot of times if you're seeing this in your kids, it's usually a dam problem. So if you're seeing it in your young kids, it means that the dam's probably deficient. And the best thing you can do is make sure that you're figuring out that that dam is deficient. So things that your veterinarian can do is to get whole blood send off for at least vitamin E concentrations, but vitamin E and selenium both are better, to make sure that you're diagnosing the correct thing. Because if you are thinking that this is a white muscle syndrome and it's actually not, you can over supplement with vitamin E and selenium, which could have actually similar clinical signs and even lead to death. And so that's why you need to really make sure that you and your veterinarian are testing for this and making sure that this is actually a problem, making sure your area is deficient, and then supplementing in the diet, especially with the with the dams is going to be really crucial to this. And then, as Dr. Pelzer mentioned in the comments, and I just have my notes here, we do have the injectable supplementation, so Bozy and Musi, that I know all producers love. You just have to be careful with it, remembering that vitamin E is a fat-soluble vitamin, so you can't be giving this too much. It's going to stay in the system for a while. One dose of it's going to last for a while, so you absolutely cannot give too much of it, or you will see devastating results. And then, since I'm just kind of on this topic, I'm just going to, the floppy kid syndrome is, and this is just kind of a general, when the kids aren't doing well, and it's, again, it all goes back to neonate management. So everything is making sure that the neonates have good nutrition, making sure they're able to stay warm, making sure that they're up and suckling frequently, making sure that the dam has good nutrition so she's milking appropriately. And if there's any health issues, pneumonia, diarrhea, those are things that will cause them to have low blood sugar, that will cause them to get really sick, and those should all be addressed by a veterinarian as soon as you notice them.
All right, thank you. Thank you, Dr. Stewart. So we did, Dr. Pelzer, so both you and Jamie addressed selenium deficiency, and you mentioned Bozy injections. You might have addressed this in the chat. I didn't get a chance to read it, but to which animals do you give Bozy? To which animals?
Those in the post or whatever you call it in the chat, it's a third of a cc or a ml to the lamb or the kid. Okay. And that will provide them with vitamin E and selenium for about 3 weeks. So even though you might do that, you still need to provide mineral to the ewes or the does. But if you watch these little guys, they'll start eating mineral within a week of life. And so they're going to start collecting or absorbing mineral on their own so that they avoid those deficiencies. One thing about the polio issue that you might consider is that if corn gluten is being fed, it has a fairly high amount of sulfur in it, and that in itself can result in polio. Unfortunately, those polio cases do not respond as well as the straight thiamine type polio. Likewise, it's an additive effect. So if you have a high sulfur content in your water, that can complicate the use of feeding corn gluten, resulting in a polio-like situation.
Okay. I'll just ask the other question on your list, Dr. Pelzer. If your flock presents with sore mouth at their first lambing, would you recommend vaccinating for that next year? And is there any way to get rid of sore mouth on the farm?
Once sore mouth is present, it's always going to be present. The virus lasts a long time in the environment, and individuals will shed the virus in their skin cells, even though they don't have any lesions or active sores from sore mouth. So once a farm has sore mouth, the farm will always have sore mouth. Sore mouth, unless it's impairing the neonate from eating, or if it's causing such severity of lesions on the teats causing mastitis, ORF is generally, or sore mouth is generally left alone. It looks worse than it is, I guess, but the only time I really recommend using the ORF vaccine is to expose animals to ORF so that they won't develop it at an inappropriate time. And that inappropriate time is when they go to a ram test or a buck test or for a sale of some sort or to a show. So that's the other aspect. There is a vaccine. And if you've never had ORF and you use the vaccine, you will now have ORF in your flock or herd, because the vaccine essentially is live virus. And what you're doing is you're giving a controlled ORF infection. And so that vaccine, as well as a normal ORF infection, will provide about 3 years of immunity to those animals.
Thank you, Dr. Pelser. Going back to Dr. Zajac. So there were a number of questions on effective on dewormers, including some natural products that are out there. So these will be, how effective is BioWarmer in reducing worm loads or parasite infections? And should we be thinking about giving it to our lambs and kids?
Well, BioWarmer, if you're not familiar with it, is a fungal organism that is fed to animals, and then it passes through the digestive tract, comes out into the manure. The fungal spores begin growing and produce a net of hyphae that can capture the parasite larvae that are developing in the manure at the same time. And effectively, they feed on those parasite larvae. The fungus feeds on the larvae and kills them. And so this is a strategy for reducing parasite numbers on the pasture. It doesn't impact the adult worms that are in the animals, but it will reduce numbers of larvae on pasture. And there have been a number of experiments with this fungus, and in fact, it really does cut down on parasite numbers in the manure. It's not going to be a 100% solution to a parasite problem. It's just another component of what we would describe as an integrated parasite control program, where you're using a number of different components, all of which contribute to giving you parasite control on your farm. So I think for some people, it's a perfectly viable part of their parasite control program. It does require being fed to animals. If you're not routinely feeding animals pelleted feed or a grain supplement, it's going to be very difficult to get the BioWarmer into them. It is sold, it's sold as just the fungus itself that can be mixed with feed, or as a nutritional supplement called Livamol that you could buy and just feed that to the animals, but it does need to be ingested. So in that sense, it may work well in your system. It may not work so well. There is a cost to it. You may find that it's more expensive than you would like to use for your animals, or the cost may be just fine. So I mean, there's trade-offs to any product that you use, but certainly it could be a very helpful adjunct to what you're doing. You don't feed it all year long. I don't have time to kind of go into strategies for using it, but it wouldn't be a product you would feed year round or anything like that. You'd want to target those animals and those times of year where you anticipate having the largest numbers of parasite larvae on the pasture.
Okay, thanks. And just a follow-up to that, before we move away from effective dewormers, are copper metal bolus safe for sheep for the treatment of internal parasites?
There's been some work with the copper boluses with sheep. I think the levels at which you need to give the copper bolus, those copper oxide wire particles, the levels for parasite control aren't particularly high. So I think in many, many cases it would be safe. However, as you know, if you own sheep, sheep are more susceptible to copper toxicity than goats. And I think it would be very wise to consult with your veterinarian first. Some people live in high copper areas. Just make sure, talk it over with your veterinarian, make sure that you're in a good situation to try using the copper boluses.
Okay. All right. Thank you, Dr. Zajac. Moving back to Dr. Stewart. Dr. Stewart, the next question that I have on here is a producer said they had a yearling doe that developed epiphysitis last trimester. How do I help her to straighten her leg and reduce any soreness that she might have? And they recently changed their mineral program.
Yeah, so kind of as you alluded to with the fact that you changed your mineral programs, and for those of you who don't know, epiphysitis is typically an issue with the amount of calcium. Usually there's an over-supplementation of calcium in relation to phosphorus. And so correction of this is required to help you fix it in the herd, prevent any other cases. One of the other things that I would also, and I'm sure it sounds like maybe you work with a nutritionist or extension specialist or a veterinarian already since you changed your mineral program, is to make sure that you're ruling out something like CAE. So that's something else that you could see that would cause some soreness and some swelling that might make it look like that her leg. So making sure that you rule something like that out that can affect those joints there. Otherwise, the best things that you could do is doing stall rest on soft bedding, making sure that you're doing frequent corrective foot trimming. That's going to kind of help to make sure that leg can straighten out over time. And then plus or minus NSAIDs. So remembering that sometimes long-term NSAIDs like meloxicam or flunixin are the ones that we use most commonly. If you do those long-term, you can see some adverse effects. So I wouldn't recommend giving anything like that without consulting your veterinarian. If it's a doe that's very special to you, one of the things that you could consider is trying to find a large animal surgeon or somebody who specializes in limb deformities like that, and doing radiographs. The radiographs will help you to determine kind of how severe it is, what your prognosis would be, and any other potential therapies. But as far as things that you could do at home, it's mostly just the stall rest, soft bedding, and making sure that those feet are staying trimmed appropriately.
Okay, thank you, Dr. Stewart. Dr. Pelser.
Yes.
You're on again. I'm gonna try to jump around a little bit to get some of these questions addressed. One question that came in was, how can you prevent caseous lymphadenitis in sheep and goats? And is a vaccine effective? And should it be included in a vaccination program? And the follow-up to that would be, how long does that persist on farms after all infected goats have been removed?
Okay, so that could be an hour-long discussion. But to summarize it in maybe 3 minutes, caseous lymphadenitis is a bacterial infection, as you know, and it generally shows up in the lymph nodes of the animal, especially in the front of the shoulder and around the jaw. The organism also can form abscesses internally, like in the liver and the lungs and in the kidney. And so we don't see those. And some people may say that the ones that we see around the head and the neck, that's just the tip of the iceberg. So the way the organism is transmitted is those abscesses rupture, and then that pus contains thousands of organisms, and the animals will rub up against something because those abscesses itch, and then another animal rubs up against that area because they're feeding out of the same feed bunk, or they have an itch and they're scratching, and then the organism enters their skin. That's the most common way. The other is that if there is a lung abscess, organisms can actually be spread via the breath to another animal. Once the organism is out in the environment, unfortunately, it can live in the environment for 9 months to a year. So it's a very hardy organism outside of the body. The best way to control the spread of infection is to get rid of those animals that have the disease. They need to go somewhere else. There's been studies where if you open up that abscess, clean it out, and it will shed organisms from that abscess during the healing process for about 35 days. So during that time, that animal is just walking around depositing new sources of infection. In regards to the vaccine does not prevent infection. What the vaccine does is it prevents the development of the abscesses. So in a way, it helps cut down on the rate of transmission because you don't have these abscesses opening up and then spreading the organism in the environment for others to pick up. But you're really not resolving the animals that are infected. There is a sheep CL vaccine and there's a goat CL vaccine. It's recommended that if you use that vaccine that you give that to young animals like 2 to 3 months of age. There have been reports that when the vaccine is used in older animals, they have a type of an anaphylactic reaction to that shot, especially if they've already been infected with CL. And so it would be something that would help the meat quality for your lambs and your kids. But other than that, I don't really see the vaccine having that large of an impact on an operation.
Okay, thank you, Dr. Pelser. Dr. Zajac, got a question that came in. What are some ways to prevent and treat coccidiosis? And what are your feelings about sulfa in the treatment of coccidia?
So I'm really glad the hour is almost up because I think coccidia is a really tough, topic. I think to a large degree, there's an awful lot about coccidia and coccidiosis that we don't understand very well. And I think in particular, making really good decisions about treatment can be difficult sometimes too. The products, there's not that many products out there that are available for treatment. You mentioned sulfa. The ionophore products like lasalicid and monensin. There's decoquinate that's used. These things are to a greater or a lesser degree available and approved for sheep and goats. They're not all approved for both. But though that group of products really don't, oh, and I forgot amprolium, which is widely used. But all of those products go in and stop the coccidia at some point in their multiplication cycle in the animal, but they don't get rid of it. In the same way that when you have an effective dewormer, when you treat the animal, man, those worms are gone. But with coccidia, with the drugs that we mostly have available here, what you're doing is just suppressing it so they don't go away altogether. And you still have a lot of coccidia cycling through your animals. We don't understand really all that well what makes some animals get the disease coccidiosis and others not get it. They all get infected with coccidia. Lambs, kids get infected with coccidia within days of birth. So they've got the infections, but then at certain points, they develop disease. And we think probably that some of those factors that contribute to the development of disease would be change. So really change is the kind of critical thing. When you have an environment in the intestinal tract, the coccidia are part of that environment. They're doing their multiplication and carrying out their life cycle. And everybody's in this very delicate balance. But as soon as you shift that balance, when you change the diet, when you wean the animal, when they go from eating hay and grain to eating really lush grass, some of those things that represent change affect that environment in the gut. And now the coccidia can get the upper hand and the balance shifts a bit. And now you can have problems with coccidia where you didn't see it before, even though those animals were infected. And then there are different species of coccidia that are more pathogenic than other species. It's a very, very complex dynamic in the animal. So what you can do really is try and anticipate when coccidia would be a problem, and then do your best to try and avoid the problem developing. We always make recommendations about trying to limit accumulation of the little egg of the coccidia, what we call the oocyst. Try and keep those oocyst numbers down as much as possible. Numbers will build up around in areas where animals congregate. And let me say too, we're talking about a young animal disease. Adult animals have coccidia, but it's very, very unusual, very, very unusual that you would see coccidiosis in an adult animal, the disease itself. This is a young animal disease. Try and keep the accumulation of oocysts down, feed off the ground. So if you're giving feed, you're putting it in feeders. Try and have feeders that goat kids can't jump into and then defecate in and leave oocyst numbers. And then try and use some of the products to control the levels of coccidia in the animals, reduce the numbers, these kind of common products that we have available that are used. And then for treating actual outbreaks of coccidiosis, probably the things you want to use there would be amprolium or corid or the sulfas. And I don't want to take up all the rest of the time. I'll stop there. And so you get a chance to ask Dr. Stewart another question.
Delia, you are muted.
I'm sorry. I wanted to ask Dr. Zajac a quick question before we move on. And it's just because I see it here and we get asked this question a whole lot. It's about doing fecal egg counts. Do you recommend that producers do their own fecal egg counts? And if so, how often and how should they use that on their farms?
So fecal egg counts are a fair amount of work. And I think before undertaking them, you need to decide what it is they're really good for and what your goal is in doing them. I don't think they're particularly good as a way to monitor health of animals. I think Famagicard is way, way better than fecal egg counts. Where I see fecal egg counts being very valuable is in assessing whether your drug treatment worked. If you want to know if you gave a treatment, did it actually kill the worms? Fecal egg counts are the way to determine that. And then the other thing that they're terrific for, and that I also would highly recommend to people, is in identifying those animals that are most resistant to parasites. And I think in addition to having a Famagicard, I want to encourage everybody to select animals in their herds and flocks that are more parasite resistant, because then you have to worry less about whether the drugs are effective in the first place.
Keep forgetting to unmute. Thank you, Dr. Zajac. Dr. Stewart, will you provide an update on recommended antibiotics and uses in small ruminants? And can small ruminants build up resistance to antibiotics?
So the biggest recommendation I can give you about antibiotics is to have your veterinarian involved when making those decisions. So, because to answer the second part, absolutely they can develop resistance. So we want to make sure that we're using antibiotics appropriately. We're using them when they're necessary and not just anytime an animal appears a little off. We don't want to be giving it an antibiotic, because the same, echoed with the parasite resistance is we are dealing with the same things in human medicine, and we're dealing with the same things in all of veterinary medicine is antibiotic resistance. So really it's going to depend on working with your veterinarian, because depending on what the actual issue is, the antibacterials we want to use for respiratory disease is going to be very different than the ones we want to use for clostridial disease. And veterinarians, that's what we get extensive training on, is understanding the different bacterias. And so that's why working with them is extremely crucial.
Thank you, Dr. Stewart. Dr. Pelser, I'm going to try to, I guess, combine two questions in one, and this will probably be the final question before we end today's Q&A. But Dr. Pelser, producer indicated that they had a goat that was foaming at the mouth, and it happens occasionally, and he was checked for bloat but did not have it. Any ideas?
I suspect that that goat has some tooth issue. They can get abscess teeth just like we do. Also, sometimes, especially in goats, they'll get this thing called ridge mouth, where the teeth don't line up quite right anymore. Similar thing occurs in horses, where they need to get their teeth floated. You can float sheep and goats' teeth and knock those edges off. And that seems to help, at least for those animals' ability to properly chew their cud, as well as that enhances their digestion of their feed. So I would think if they foam, this one has trouble keeping the cud and that kind of thing, that there's something going on inside that oral cavity or inside the mouth that needs to be investigated. They can develop kind of a slobbery condition if they wind up eating moldy red clover, but that's about it.
Okay. Thank you, Dr. Pelser. Thank you to all our veterinarians that were able to join us today. Thank you, Dr. Zajac. Thank you, Dr. Stewart. Thank you, Dr. Pelser. Before leaving, I have a short poll that I would like to ask our participants to help us out with. We need this for our own purposes in planning future programs, and also our administrators like to see how we did with our programs. So please, if you'll take a minute or two to fill out the poll that's on your screen, we would really appreciate it. And then I'll open up a question to all three veterinarians. We had a question, and it was, what recommendations do you have for a pre-vet student attempting to earn animal experience with ruminants? So I figured that would be a good last question for each of you guys to address for that vet student who's hopefully on today.
Well, my wife is standing here, and she is the associate, or she's the director of admissions. So I'll let her speak on that for 2 minutes. She only gets 2 minutes.
Thank you.
Hi, how are you? I'm the other Dr. Pelser. So it can be very difficult for those pre-veterinary students to identify experiences with veterinarians for a couple of reasons. You know, if they're under the age of 18, they're considered still a child, and there are child labor laws here in the state of Virginia that prohibit them from working with a veterinarian because of, you know, you're working with sometimes equipment, other things that are deemed dangerous to children. You know, certainly right now in the times of the pandemic, it's going to be very difficult for sure. And also the other issue is just staffing in general and who's going to have oversight of that individual while they're in the veterinary hospital. My recommendation though is, especially if they're starting maybe junior high school, and looking for experiences, is to do some volunteer experiences at a local shelter or humane society, and try to find a time maybe when one of the community veterinarians is going in to examine the animals, and just, you know, shadow that veterinarian, not necessarily looking for hands-on experiences, but getting to know that veterinarian. That is a great way of networking. And then the other recommendation is, if they are reaching out to the veterinarian in a small animal practice, is to ask for shadowing opportunities, not necessarily paid opportunities, because I think that veterinarians are probably more open to having them come in maybe once or twice a month, and that gets the foot in the door. And if you're lucky enough to live on a production farm where you have production animals, is every time that veterinarian comes out to provide preventative care or medical care, surgical care to one of the animals on the farm, is to hang on to that veterinarian, express your interest in veterinary medicine, and that again opens doors. So that's kind of my recommendations.
Thank you, the other Dr. Spelser. Thank you for that. Dr. Zajac and Dr. Stewart, did you have anything to add to that?
Sounded like great advice to me.
Yeah, it was all really good advice. I don't think I have anything else to add.
Okay, so thank you to all our veterinarians that were able to join us today and answer these questions. For our participants, thank you for participating today. Thank you for submitting your questions. This is being recorded, and hopefully we will have it up on some forums soon. YouTube, we'll email you and let you know. What I'm gonna try to do as well is I'm gonna try to put these questions together and put answers, and maybe do just do a fact sheet on these questions. So we might address most or all of these questions that were submitted. So thank you again, and enjoy the rest of your day.
Thank you.